The incidence of colorectal cancer among millennials in the United States is rising, and the reasons for the trend are unknown. A study by the American Cancer Society found that 3 in 10 colorectal cancer diagnoses are now in patients younger than age 55. Their findings appeared in the Journal of the National Cancer Institute. The rising rates in young adults is a concern because the recommended age for screening in average-risk adults is age 50. The study raises the question whether there should be a change in guidelines to begin screening at a younger age. Colorectal cancer is the second leading cause of cancer deaths in the United States, killing more than 50,000 Americans each year. March is Colorectal Cancer Awareness Month. We spoke with a specialist at Advanced Gastroenterology and Surgery Associates to find out how early detection can make a difference.
Colon cancer screening is very important because if colon cancer detected early enough, it's very treatable and it can be preventable. If you do a colonoscopy and you see a polyp, the majority of the colon polyps that will grow into colon cancer, once you remove the polyps, that will prevent the patient from having colon cancer. The procedure is so simple and it's quick. It is beneficial to have the colonoscopy done for sure.
And I think it's important to note that colon cancer is the second most common cause of cancer death in the country and the third most common cause of cancer in men and women. And most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps.
Recently, they have a new guideline just came out a couple years ago, and we're starting the colonoscopy at 50 years old in the Caucasian population if they have no family history of colon cancer. If they do have colon cancer in their family history, then they need to do it at 40 or 10 years younger than the person in their family that have colon cancer. So let's say if a family member having colon cancer at 45, that person needs to have a colonoscopy at 35. Some of the new things we recommended for a patient to do a colonoscopy, like the Black population or diabetic patient, they should have the colonoscopy starting at 45 years old. Also with obesity, for these patients, they should have the colonoscopy sooner, starting at 45. The day before the procedure, we give the patient some bowel preparation to clean out the colon. The next day, we bring the patient back to the endoscopy center. They will be sleeping the whole time. It takes about 15 to 30 minutes to have the procedure done. We have a long scope. It has a light and a camera at the end of it, so we look at a TV monitor to see where we are going. We will go into the colon and we will examine the colon thoroughly to make sure they have no colon cancer. If they have any polyps, we take them out right then. The procedure is simple and the risk is really small, it's less than 1% chance of complications. You can come in and go home in the same day.
Most patients after the procedure, after having had a colonoscopy, would say it wasn't as bad as I thought.
For more information on the Advanced Gastroenterology and Surgery Associates and their services, please click the Crush Colorectal Cancer Story link icon on our homepage, yourhometownhealth.com.